Hey, Scott. So, yeah, hearing from a couple different folks here. Number one, I am hearing from a couple of Republican aides that this offer now made by the Democrats that they will vote to reopen the government if Republicans provide a one-year extension of those Affordable Care Act tax credits is not going to be accepted by Republicans. I was told that this offer was actually made several weeks ago, that it was rejected by Republicans. We're also now seeing a statement come out from the White House on this. A White House official saying that Democrats are making clear they're holding the American people hostage for other spending. This is a huge climb down from their initial position, shows they're under massive pressure. They go on to say that Democrats should reopen the government today, and the administration then will meet with them on the tax credit and work on it. So going back, really, Republicans sticking with their initial position that they are open to talking about these health care tax credits, but only after Democrats provide the votes to reopen the government. So if this kind of continues, this breakthrough might not be much of one at all, and we might be kind of back to where we were, where both sides are really dug in firm. And remember, for Democrats in particular, I do know that there are some more moderate Democrats out there. They want to find a way forward. They want to reopen the government, but they are getting pressure from maybe more centrist or more progressive Democrats who are saying, look, we just got big wins on Tuesday. The American people are telling us that they want us to hold out and really fight for health care, and we need to do that. So I think undetermined yet exactly if there's going to be a vote today, what that vote is going to be on, and how much longer the shutdown is going to go.
After so many failed votes, it's clear we need to try something different. What the Senate is doing isn't working for either party and isn't working for the American people. Democrats have said we must address the health care crisis, but Republicans have repeatedly said they won't negotiate to lower the health care costs until the government reopens. So let's find a path to honor both positions. Democrats would like to see an end to this shutdown, and we want to respect Leader Thune's desire not to negotiate on ACA until after the government reopens. Therefore, we'd like to offer a simple proposal that would reopen the government and extend the ACA premium tax credits simultaneously, and then have the opportunity to start negotiating longer-term solutions to health care costs. Let's do all three. I've spoken with my caucus, and Democrats are offering a very simple compromise. Democrats are ready to clear the way to quickly pass a government funding bill that includes health care affordability. Leader Thune just needs to add a clean one-year extension of the ACA tax credits to the CR so that we can immediately address rising health care costs. That's not a negotiation. It's an extension of current law, something we do all the time around here, as we all know. But we also offer this. Let's create a bipartisan committee that will continue negotiations after the government reopens on reforms, ahead of next year's enrollment period, to provide long-term certainty that health care costs will be more affordable. This proposal reopens the government and ensures working families who are shopping right now for their health care get certainty and financial relief. While open enrollment has begun, insurers can update their rates after we pass a simple extension of the tax credits. With this approach, we do not negotiate health care in the shutdown, as Leader Thune has maintained he wishes, and the American people get the tax credit extension they want. That is what many of our Republican colleagues have floated over the last 6 weeks as a compromise, a one-year tax credit extension and reforms to the credit beyond that. We will agree with the Republican request not to start negotiations until after the government reopens. All Republicans have to do is say yes to extend current law for 1 year. It makes sense. And since what we're proposing is only a simple extension of current law, the Senate could do this within a few hours. This is a reasonable offer that reopens the government, deals with health care affordability, and begins a process of negotiating reforms to the ACA tax credits for the future. Now, the ball is in the Republicans' court. We need Republicans to just say yes.
Welcome back, family. America stand once again. The government is shut down, not because of war, not because of disaster, but because of politics. A nation divided over healthcare budgets and the lives of millions of working class citizens. Welcome to True Verdicts. Let's uncover the truth behind the shutdown and the push to reopen the government. Relax as we break down the topic.
Thanks very much for joining me. I think there's a lot of confusion out there regarding the government shutdown. How did it happen? Why is it continuing? How do we resolve it? I think these are the questions that are on people's minds. So let me just say a few words about that. Without boring you about Senate rules, the shutdown took place 5 weeks ago because the majority party, in this case the Republicans, need 60 votes in order to pass a government budget. They only have 53 votes. The Democratic caucus has 47. And what has always happened under these circumstances is that the majority party sits down and negotiates with the minority in order to get the 60 votes. That always happens, except now. For the first time that anyone can remember, Republicans have said it is our way or the highway. We are not negotiating it. You take it or you leave it, and that's the way it is. And then, to add insult to injury, to make it clear that they have no intention of negotiating, unbelievably, at a time when federal employees are not getting paychecks, when kids are being threatened without getting the nutrition they need through the SNAP program, when air traffic controllers are not being paid, in the midst of all of that, the Republican Speaker of the House, Mike Johnson, has given his members of the House of Representatives, a 6-week paid vacation. Incredibly, they are not here in Washington, D.C. They are home. God knows doing what. So in the midst of a government crisis, but the Republicans of the House have said, you don't have to come to work. I mean, that's really quite unbelievable. So what are the issues that need to be negotiated? When we talk about negotiations, what are we talking about? And let me tell you what they are. If Democrats, and myself as an independent, were to agree to the Republican clean resolution, it would mean that over 20 million Americans would see a doubling in their health care premiums through the Affordable Care Act. 20 million. That's on average. In my state of Vermont, I'm hearing from people who are looking at a tripling or a quadrupling of their health insurance premiums. People cannot afford that. And as a result, people will lose their health care. Further, if we were to agree with the Republican proposal to pass their clean resolution, it would mean that 15 million Americans will next year be thrown off the health care they currently have, because in Trump's big, beautiful bill, the Republicans made massive cuts to Medicaid. And there are studies out there, and this point is not being made enough. There are studies out there that show that some 50,000 of our fellow Americans, lower income and working class people, will die unnecessarily every year because of that reality. 15 million people being thrown off their health care. It would also mean, if I voted yes to open the government tomorrow, that nursing homes, rural hospitals, community health centers will be devastated because of cuts in government funding. They will have to, in some cases, close down, and in other cases, just limit the number of people they can provide health care to. And by the way, I should mention, as many of you know, that all of those massive cuts to Medicaid and the Affordable Care Act were done for one reason, and that is to give $1 trillion in tax breaks to the top 1%. Well, you may disagree with me, but I happen not to believe that Elon Musk, worth $500 billion, or Jeff Bezos, or Mark Zuckerberg, or Larry Ellison, or the other multi-billionaires, need a tax break which results in millions of people losing their health care. Just think about it. Tax breaks for Elon Musk and people losing the health care they need to stay alive. Doesn't make a lot of sense to me. Now, for those of you who may be following inside the Beltway politics, you may have heard that there are certain negotiations going on between moderate Democrats and Republicans. And I must tell you that I am strongly opposed to the proposal that is being floated about. What the proposal suggests is that Democrats will be given the opportunity to write their own bill to extend the tax credits for the Affordable Care Act, and that they will be able, that the Republican leadership will give them a vote on it. In exchange, they will vote for a Republican proposal to reopen the government. Sounds good. Good idea, right? It is not. The devil is in the details. The Republicans would agree to Democrats writing a health care bill because they know that even if that proposal were to pass here in the Senate, it would go nowhere in the House. House would not entertain it. And if by some amazing chance it were to pass in the House, Donald Trump would veto it. So in other words, it amounts to an empty gesture. Some of my colleagues would feel great. They can go back home and they say, you know what, I cast the vote. Here's the bill that I voted for. Great bill. It would have prevented your health care premiums from doubling. It would have prevented millions from losing their health care. Hey, I'm a great guy. But they understand that that bill was doomed to go nowhere in a hurry. It would do absolutely nothing to protect the health care needs of the American people. And that is not something that I can support, nor should any other member of the Senate. Now, as some of you know, importantly, there were elections yesterday all across the country, significantly in New Jersey, in Virginia, in New York City, and elsewhere. And the reality is that from one end of this country to the other, from California to New York, Democrats did very well. And there are a lot of reasons why people win elections, that's for sure. But one of the reasons, in my view, is that people are sick and tired of the Republican attack against the working families of this country. And the reality that Republicans would double their premiums, throw 15 million people off of health care in order to give tax breaks to the very richest people in America. That is not a message, frankly, that resonates any place in America. That's what the Republicans had to defend. And you know what? The American people said, no way, you're wrong. Even Donald Trump, interestingly enough, just acknowledged this morning that the shutdown has been, quote, worse for us Republicans than for them. And that Republicans are getting killed. That's Donald Trump. And he's right. He's right. The Republicans are getting killed because the American people, understandably, can't afford to see a doubling in their health care premiums in order to give tax breaks to billionaires. That's why the Republicans are losing on this issue. And it's not just yesterday's elections. Poll after poll says the same thing. People are holding Republicans accountable for the shutdown because they refuse to negotiate to protect the health care of millions of Americans. Now, I want to see this shutdown ended as soon as possible, and so do you. It is hurting a lot of people. And what we need, what we desperately need, is an agreement on legislation that will really and truly protect the health care needs of the American people. And that legislation that we agree on, the proposal that we agree on, must have a guarantee that it will pass the House and that it will be signed by the President. Otherwise, it is a meaningless gesture. That is the commitment that we need. So in this very difficult moment in American history, when working families are under attack, when the billionaire class has never had it so good, when we are moving every day toward authoritarianism under a president who wants more and more power for himself, we have got to stand tall. We got to represent the needs of the working families of this country. That's what yesterday's election was about. That's what they want us to do. And to fold right now, to give in to the Republicans, despite massive opposition from the American people, would be a serious, serious mistake.
The latest shutdown was triggered when Republicans proposed massive cuts to Medicaid, a lifeline for millions of low-income and middle-class Americans. The plan would have been forced healthcare premium to skyrocket, in some cases doubling overnight. For families already struggling to make ends meet, this isn't just politics, it's survival. Cutting Medicaid means fewer doctor visits, unavoidable prescriptions, a return to the days when healthcare was a privilege, not a right.
My name is Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of 45 years. I was a union carpenter for over 30 years and still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, it's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
Democrats have drawn a line in the sand. They have told Republicans, reopen the government, but only if we can agree to extend the Affordable Care Act tax credit for 1 year more. This extension could save thousands of families from losing coverage or paying twice as much as basic medical care. Healthcare has once again become the battlefield for Americans' future. The Republican court aims to reduce government spending, but at what cost? And Democrats argue that extending ACA Act credits is not luxury, it is necessity.
Saying to you, as this is a Republican shutdown, my friend, you are in control of the White House, you are in control of the House, and you are in control of the Senate. And if you went home to a food bank instead of going to Mar-a-Lago to eat at a gold-plated dinner while people are starving, you might see and hear your constituents, sir. You are blind to the suffering of your people.
Let's cut the crap. This is a Republican shutdown. You can scream Democratic shutdown from every podium in D.C., and it still won't make it true. You can twist the facts all day, but the truth doesn't change just because it's inconvenient for your talking points. Republicans control the House. Republicans walked away from the negotiating table. Republicans are the ones holding the government hostage. And let's be even clearer. Democrats are fighting to protect people's health care, to extend the ACA subsidies that help working families afford coverage. That's it. That's what this is about. Making sure Americans can see a doctor without going bankrupt. Making sure children get the medicine they need. Making sure families aren't choosing between insulin and groceries. But you and your party want to spin this into some ugly, dishonest narrative about giving immigrants free health care. That's your boogeyman. That's the bait. And it's bullshit. This isn't about immigrants. It's not about freeloaders. It's about everyday Americans who work hard, pay taxes, and deserve not to be destroyed by a medical emergency. So let's not pretend this is a debate over runaway spending or border security. This is about your refusal to negotiate, your refusal to do your damn job. And let's be real, you don't even want a deal. You want to shut down. You manufactured this crisis because you think chaos helps your politics. You want to gut the ACA. You want to shred the safety net. And if it means punishing the poor, punishing veterans, punishing working class families to get your way, you're fine with that. You're fine with furloughing workers, shuttering services, and leaving people desperate because you think that pain gives you leverage. It's cruel, it's calculated, and it's cowardly. You lecture from your cushy position in Congress, fly home to safe districts and vacation in luxury while real people are stuck wondering how they'll pay rent if their paycheck doesn't come through. You don't go to the food banks. You don't see the empty shelves. You don't hear the stress in a mother's voice as she juggles 2 jobs and a kid with asthma. But Democrats do. And that's why they're standing firm. They're fighting for health care. You're fighting for headlines. They're protecting families. You're protecting donors. They want to govern. You want a spectacle. So no, this isn't both sides. This isn't some shared blame scenario. This is your mess, your shutdown, and your responsibility. And you are blind to your people's suffering.
As negotiations continue behind closed doors, federal workers remains unpaid. Public services are stilled and millions waiting for Washington to find common ground. The question remains, will political pride once again overweigh the needs of the people? At the end of the day, this fight isn't just about budget or bill. It's about human lives. The power to heal, to protect, to care for one another is what defines a nation. As Americans wait for a solution, True Verdict will continue to ask these hard questions and speak truth to the power. Big shout out to all the Stitches video that made this report possible. If you believe every American deserves affordable health care, don't forget to like, share, and subscribe. And join the conversation below. Your voice mattered.